What is PCR, and how does it help diagnose leukemia? Imagine being able to find a tiny needle in a huge haystack. That's what PCR, or polymerase chain reaction, does for doctors when they're trying to detect leukemia. It's a lab technique that makes millions of copies of a specific piece of DNA or RNA from a small sample. This process turns a tiny amount of genetic material into enough to analyze closely. It's like magnifying a small clue into a clear picture. In leukemia diagnosis, PCR is especially useful because it can identify specific genetic abnormalities or markers that are unique to leukemia cells. These markers include fusion genes, mutations, or rearrangements in the DNA. For example, the BCR-ABL fusion gene is a common marker in chronic myeloid leukemia. PCR can detect this gene even if only a few leukemia cells are present in the blood or bone marrow. This makes PCR a powerful tool for early detection. PCR helps doctors by confirming the presence of leukemia through these genetic markers. Sometimes, traditional methods like looking at cells under a microscope or doing cytogenetic tests might miss these clues, especially if the number of leukemia cells is very low. PCR high sensitivity allows for more accurate diagnosis and classification of the leukemia type. It can tell whether the disease is slow-growing or aggressive based on the genetic features found. Another important role of PCR is monitoring minimal residual disease. After treatment, some leukemia cells might still remain in the body, even if they are too few to be seen with standard tests. PCR can detect these tiny amounts of remaining leukemia DNA or RNA. This helps doctors see if the treatment is working or if there's a risk of relapse. Early detection of relapse can lead to timely adjustments in therapy. PCR also guides treatment decisions by identifying genetic mutations that influence how the leukemia behaves and responds to therapy. Knowing these details helps doctors choose the most effective, personalized treatment plan for each patient. In slow-growing leukemias like chronic lymphocytic leukemia, PCR can track disease progression over time by detecting small amounts of leukemia DNA, giving a clearer picture of how the disease is changing. Because PCR is so sensitive, it can find one leukemia cell among hundreds of thousands or even millions of normal cells. This makes it invaluable for early diagnosis, ongoing monitoring, and catching relapse early. Overall, PCR has transformed how leukemia is diagnosed and managed. It offers a quick, precise, and detailed look at the genetic makeup of the disease, helping doctors make better decisions and improve patient outcomes. Always remember, if you or someone you know is dealing with leukemia, it's essential to consult healthcare professionals who can interpret these test results in the context of the full clinical picture.